Hello everyone, I am Dr. Adarshdeep, and in today's lecture we are going to discuss about effects of aging on skeleton and bone disorders. Bones undergo a lifelong process of remodeling. Mature bone tissue is removed and new bone tissue is formed. Bone remodeling is a highly regulated process that maintains a balance between bone resorption and bone formation, so maintaining the skeletal integrity. This balance changes with the increased age, resulting in a loss of bone tissue. The aging bone has reduced mineral content and is prone to osteoporosis, which is a condition in which bones are less dense, more fragile, and prone to fractures. As people age, the rate of bone resorption by the osteoclast cells exceeds the rate of bone formation, so bone weaken. And all this happens due to inactive lifestyle, hormonal changes, loss of calcium and other minerals in the bone. So let us study about different type of bone disorders and effect of aging on the skeleton.
Age-related changes in bone cells and matrix has strong impact on bone metabolism. So there are certain changes which are noticed in human body with respect to skeletal organization. These are decrease replicative and biosynthetic potential of osteoprogenitor cells. Elderly persons, when compared with those of younger individuals, it was found that there is a decrease in replicative power and biosynthetic power of the osteoprogenitor cells. Second is reduced biological activity of matrix-bound growth factors. As I have explained you earlier that extracellular matrix not only binds growth factors and controls their bioavailability, it can also control growth factor receptor signaling. Indeed, the signaling of many growth factors is regulated by dynamic interactions between growth factor and extracellular proteins, adhesion receptors, and growth factor receptors. Actually, they are mitogenic to osteoprogenitor cells. Mitogenic means they act as an agent that stimulates the mitotic cell division. That means more is the division in osteoprogenitor cell, more will be the osteoblastic synthetic activity. So bone is formed regularly. Reduced biological activity of matrix will definitely affect the osteoblastic synthetic activity. Third is the reduced physical activity. As the age increases, physical activity decreases, and this increases the rate of bone loss in the elderly person due to the decrease in mechanical stimuli which act as important stimuli for remodeling of the bones. It is supported by the fact that athletes have high bone density than the non-athletes. Due to these age-related factors, certain bone disorders are commonly noticed in the older persons. Let us discuss some of the age-related bone disorders. These includes arthritis, pseudogout, and senile osteoporosis.
Arthritis is second only to cardiovascular diseases in causing long-term disability. It is characterized by joint inflammation. On the basis of their causative agents, it is of three types. One is osteoarthritis, second is rheumatoid arthritis, and third is gouty arthritis. Let us take one by one.
Osteoarthritis is the most common type of arthritis leading to disabling conditions, especially old person of the developing countries. It is characterized by inflammation and progressive erosion of articular cartilage present at the ends of the bones at the synovial joints. In primary or idiopathic osteoarthritis, disease affects only few joints. and is called as oligoarticular osteoarthritis. But it may be generalized and spread to other joints also. The joints which are commonly involved include the hips, knees, lower lumbar, cervical vertebrae, interphalangeal joints of the fingers. In this slide, you can clearly notice the effect of osteoarthritis. In normal joint, articular cartilage is intact and bone turnover is normal. But in case of osteoarthritis, subchondral bone cysts are formed and you can see fibrillated cartilage which cause the inflammation of the synovitis membrane and also cause the thickened joint. Again you can see in first figure, this is the normal knee joint. In case of osteoarthritis, see the second figure where bone cysts are formed and cartilage is eroded. So you can see cartilage fragments. This will cause irregular joint space, fragmented cartilage, loss of cartilage and sclerotic bone and cystic changes. In the third figure, you can see the osteoarthritis advanced, in which the cartilage gets calcified and periarticular fibrosis is there, and osteophytes are also very clear in this figure. This is the slide of osteoarthritis in interphalangeal joints of the fingers. So you can clearly see the effect of osteoarthritis in these hands. Again, this is the osteoarthritis in spine, lower lumbar region. Here you can clearly see the bone spurs and degenerated disc. All these decrease the height of vertebral body. Now let us discuss the different symptoms of this disease. It causes deep achy pain, morning stiffness, inability to movements, crepitus sometimes called crepitation. It may be any grinding, cracking, creaking, grating, crunching or popping that occurs when moving a joint. People can experience crepitus at any age, but it becomes more common as people get older. Next is muscular spasm, muscular atrophy and neurologic effects. Now, the rheumatoid arthritis. It is a chronic systemic inflammatory disorder of the joints which generally leads to the inflammatory synovitis. Also, destruction of the articular cartilages and ankylosing of the joints. It is most common in the persons between 40 to 70 years old and occurs 2 to 3 times more in women than men. Generally, the small joints like metacarpophalangeal and interphalangeal joints are affected before the larger joints. Rheumatoid arthritis is an autoimmune disease triggered by exposure of immune system to certain arthritogenic antigens which stimulate and activate the CD plus V helper T cells and also beta lymphocytes to release certain inflammatory mediators and cytokines which ultimately destroy the joints. As far as effects of rheumatoid arthritis is concerned, it generally leads to inflammatory synovitis, ankylosing of joints and destruction of articular cartilages. Synovitis is the medical term for inflammation of the synovial membrane. This membrane lines joints that possesses cavities known as synovial joints. In the figure you can see the normal joint with the normal synovial cavity and membrane, and in the second case you can clearly see the bone erosion and swollen inflamed synovial membrane. So this is the condition of synovitis. This condition is usually painful, particularly when the joint is moved. The joint usually swells due to the synovial fluid collection. Ankylosis is a term used for the fusion of the joints, which can occur in several different parts of the body. These are ankle, elbow, knee, shoulder, fingers, and jaw bones. It causes a stiffness of a joint due to abnormal adhesion and rigidity of the bones of the joints, which may be the result of injury or diseases. The rigidity may be complete or partial and may be due to the inflammation of the muscular structures outside the joint or of the tissues of the joint itself. So this disease is characterized by various symptoms like swollen and painful joints, morning stiffness, juxta-articular osteopenia, erosion of bones, narrowing of joint spaces, and destruction of tendons. Third is gouty arthritis. Most important cause of gouty arthritis is precipitation of monosodium urate crystals into the joints. As the synovial fluid of the synovial joint is poor solvent of monosodium urate, these crystals accumulate there. So gouty arthritis is the end point of the group of disorders caused by hyperuricemia. That means overproduction of uric acid and its increased concentration in the blood. Uric acid is the end product of purine metabolism. Gouty arthritis is of two types on the basis of their cause and their clinical effects: primary gouty arthritis and secondary gouty arthritis. Let us see the difference between the two types of gouty arthritis. As far as metabolic defects are concerned, in case of primary gouty arthritis, there is overproduction of uric acid and its normal excretion. But in case of secondary gouty arthritis, there is overproduction of uric acid and its increased urinary excretion also. If we study the causes of both, in case of primary, it is associated with the enzyme 85 to 90% or to the deficiency of HGPRT, that is hypoxanthine guanine phosphoribosyl transferase. In case of secondary gouty arthritis, it is associated with the increased nucleic turnover. As far as frequency is concerned, primary gouty arthritis occurs in 90% of the cases and secondary gouty arthritis occurs in 10% of cases. Gouty arthritis is characterized by many morphological changes. First is acute arthritis. In this case, you can see the presence of dense neutrophilic infiltrate in the synovial fluid. Neutrophils contain crystals of monosodium urate. So you can see in this figure inflammation and excess of joint fluid. Second condition is chronic typhus arthritis. In this condition, urate crystals form visible deposition in the synovium, which becomes hyperplastic and thickened. So here you can see the condition of typhus arthritis. Third is appearance of tophi. Large aggregations of urate crystals surrounded by fibroblasts, macrophages and lymphocytes, and also large foreign body giant cells. So you can see the tophi here.
One should keep in mind that physical changes related to normal aging are not the diseases. We all age physically as we grow older. Some systems slow down while others lose their fine-tuning. People who live an active lifestyle lose less muscle mass and flexibility as they age. As a general rule, slight gradual changes are common, and most of these are not problems to the person who experiences them. Steps can be taken to help prevent illness and injury, and which help maximize the older person's independence if problems do occur.
In this part of the lecture, now we will discuss bone disorders. Developmental abnormalities of the skeleton, whether they are bones or cartilages, are complex and caused by variable causes. Bone disorders on the basis of their cause are divided into two categories. One is genetic bone disorders and other is acquired bone disorders. So first we will discuss genetic bone disorders. So as the name indicates here, their cause is genetic. So bone disorders due to gene mutations in certain transcription factors leading to problems in the migration of mesenchymal cells and their formation of condensation are called dystosis. So when there is a mutation occurs in certain transcription factors, it leads to problem in migration of mesenchymal cells and their formation of condensation, and dystosis arises. So dystosis is a disorder of the development of bone, in particular affecting ossification. Genetic bone disorders are of different types. On the basis of their causative agent, they are grouped into different categories. So first we will study those which are caused by the defects in the nuclear proteins and transcriptional factors. So first disorder here is syndactyly, which is characterized by fusion of two adjacent digits. It is caused by the gene mutation in homeobox 13, HOXD13 coded transcription factor. Second bone disorder in this category is craniorachis. It is characterized by the failure of closure of the spinal column and skull so that the meninges and central nervous system become continuous. It is incompatible with life, affected pregnancies often end in miscarriage or stillbirth. Infants born alive with the craniorachis die soon after the birth. Gouty arthritis. In this section, we will study the acquired bone disorders. These bone disorders are generally noticed in adulthood and may be due to the variable reasons. Let us take one by one. So first is bone disorders due to the decreased bone mass. For example, osteoporosis. It is characterized by increased porosity, fracturable bones, and may limit it to one bone or to the entire skeleton. Depending on the cause, the osteoporosis is of two types. First is primary osteoporosis and other is the secondary osteoporosis. The primary osteoporosis is the dominant form of osteoporosis and it may be senile or post-menopausal osteoporosis. So it is of two types. One is senile osteoporosis and other is a post-menopausal osteoporosis. Secondary osteoporosis is again of two types, endocrinal disorder and other is a gastrointestinal disorder. Let us take one by one. First, the primary osteoporosis, and its first type is the senile osteoporosis. It is caused due to the age-related changes in the bone cells and matrix. These changes are like decreased replicative activity and synthetic activity of osteoblasts, decreased biological activities of matrix-bound growth factors, also reduced physical activity in old age, which further increases its chances. Calcium deficiency is another cause. Increased PTH, parathormone level and reduced level of vitamin D are the other causes of senile osteoporosis. As far as postmenopausal osteoporosis is concerned, the main cause reduced secretion of estrogen. So females are more susceptible to the osteoporosis than men. Why is it so? it has been reported that 1 out of every 2 women suffer from the osteoporosis in comparison to the 1 out of every 40 men. A woman loses about 9% of cancellous bone within a decade after the menopause, while loss may be up to 35 to 50% within 30 to 40 years after menopause. So as the name indicates here, it is the postmenopausal osteoporosis. So main cause of this osteoporosis is a reduced secretion of the estrogen, which is secreted by the follicular cell of the ovaries. Actually, estrogen stimulates the secretion of cytokines from the monocytes, which in turn increase the activity of the osteoclasts. So it is clear that there is a direct relationship between the estrogen and osteoporosis. As activity of osteoclasts increase, so resorption increases and bones become weak, which causes breaking down bones at a faster rate. So, osteoporosis represents a condition of significantly reduced bone mass due to long-standing imbalance between bone resorption and bone formation. Bone resorption and formation are the essential components of the remodeling in the adult skeleton that continue throughout the life. So, here is some of the preventive measures. Intake of calcium is necessary. Appropriate intake of vitamin D. Estrogen replacing agents and recombinant of PTH, and lastly the proper exercise is very useful in these cases. Now we will discuss the secondary osteoporosis, which is caused by the endocrinal disorder and gastrointestinal disorder. Let us see what are these disorders. In case of endocrinal disorders, there is hyperparathyroidism. That means increased PTH secretion or the parathormone secretion. Second is hypogonadism. That means reduced estrogen secretion. Third is Addison's disease, in which decreased aldosterone secretion is there. And fourth is prolonged glucocorticoid therapy. As far as gastrointestinal disorders are concerned, these are malnutrition or malabsorption, hepatic insufficiency, and vitamin D deficiency in diet. So it is quite clear here that this type of osteoporosis is caused by a large variety of causes, which are mainly responsible for some other disorders but are also associated with the osteoporosis. Second is the bone disorders due to the dysfunction of the osteoclasts. It causes Paget's disease. This disease is characterized by 3 stages. First is osteolytic phase, other is mixed phase, and third is the osteosclerotic phase. Osteolytic phase is characterized by the increased activity of the osteoclasts and faster bone resorption, so forming a number of pits in the lamellar units. The osteoclast may have up to 100 nuclei and become abnormally large sized. During mixed phase, though osteoclastic activity continues but end with the predominance of the osteoblastic activity and new bone formation. This mosaic pattern of lamellar bone is peculiar feature of the Paget's disease. During osteosclerotic phase, osteoblastic activity is further increased, so the bone becomes larger than the normal and is composed of coarsely thickened trabeculae, but the cortices become soft and porous, so such bones become more vulnerable and fracturable. This disease is caused by the slow viral infection of paramyxovirus, which stimulates the secretion of IL-6, which is a cytokine, from the immune cell. This IL-6 induces the multiplication of the osteoclasts and resorption activity. Paget's disease may be monostotic when it occurs in tibia, ilium, femur, skull, vertebrae, and humerus, or maybe polystotic when it occurs in pelvis, spinal, and skull bones. In this section, we will study the third is bone disorders due to the abnormal mineral homeostasis. This includes rickets and osteomalacia. Rickets in the children is characterized by too flexible bones due to the excess of unmineralized matrix, so the leg bones curved under the body weight. The child suffers from knock knee and bow legs, so feels difficulty in movements. Other deformity is pigeon's chest, which occur as ribs have weak metaphyseal areas, so are protruded forward, and the chest looks like a pigeon's chest. In some cases, pelvis may also be deformed. Second is osteomalacia. In women is characterized by softening of bones, especially of the pelvic girdles and ribs. So the bone become vulnerable to microfractures and eventually leads to the loss of skeletal mass called osteopenia. As far as causes are concerned, the main cause of rickets in children and osteomalacia in women, especially the pregnant one, is the deficiency of vitamin D. This vitamin D helps in calcium and phosphorus balance in the body fluids and increase the calcium absorption in the intestine. The deficiency of vitamin D may be due to the number of reasons, which includes inadequate exposure to sunlight, as ultraviolet radiation of sunlight changes provitamin D to vitamin D in skin cells. Second is inadequate intake in diet. So limited dietary intake of vitamin D or poor maternal nutrition cause the deficiency of vitamin D. And another is decreased absorption of vitamin D due to the biliary tract obstruction or the cholestatic liver disease or pancreatic insufficiency. The next acquired bones disorder is hyperparathyroidism. Symptoms include oversecretion of parathormone, which increases the activity of osteoclasts and reduces the loss of calcium in urine. This leads to the disease called osteitis fibrosa, which is characterized by overactivation of osteoclasts and increased separation of calcium from the bones. So railroad tracks are formed in the bones. Bones become soft and bent. Other symptoms are hypercalcemia, that means high calcium level in blood, hypercalciuria, that means increased loss of calcium in urine, which may be up to 100 to 180 milligram per day. Sometimes calcium is deposited in the kidney, leading to the kidney stones and decreased urine output. The main causes of this disease are autonomous hyperplasia or tumor called adenoma of the parathyroid gland, while secondary parathyroidism is caused by the prolonged state of hypercalcemia, which stimulates the compensatory hypersecretion of the PTH, that means parathyroid hormone. Next is the bone disorders associated with the infections. Example, osteomyelitis. This disease is characterized by inflammation of bones and marrow due to certain pathogenic microorganisms like viruses, bacteria, fungus, but infections caused by certain pyogenic bacteria and mycobacteria are the most common. So it is known as pyogenic osteomyelitis. The symptoms of this disease are bacterial infections causes inflammation and necrosis, that means cell death of the affected bone, within 48 hours, which spreads within the bone shaft throughout its Haversian system and reaches the periosteum. This causes subperiosteal abscesses, while dead piece of bones is called sequestrum. As far as cause is concerned, about 80 to 90% of cases of pyogenic osteomyelitis are caused by infection of Staphylococcus aureus. In some cases, it is associated with the infections of Haemophilus influenzae and Salmonella. Next is Mycogenic Osteomyelitis or the tuberculosis osteomyelitis. As far as symptoms are concerned, it is generally originated from a pulmonary focus into a rib or adjoining vertebrae. It generally involves neural spines of thoracic and lumbar vertebrae, followed by knees and hips. The infection spread through intervertebral discs to involve multiple vertebrae and extends into the soft tissue, forming abscesses. So the patient feels pain on motion. Compression fractures, kyphotic deformities, and nerve compressions are also there. And as far as causes of this disease are concerned, tuberculosis osteomyelitis is a secondary infection of Mycobacterium tuberculosis, which is a bacteria. Fifth is the bone disorders associated with the Ischemia, that means reduced blood flow. And the disease is known as osteonecrosis. Symptoms includes in the affected bones, the medullary region of the cancellous bones and marrow shows necrotic regions, appearance of empty lacunae surrounded by necrotic adipocytes, and finally collapse of bone or their fracture. The symptoms depend on the location and extent of the subchondrial infraction as disturbed blood flow followed by the cell death. These generally include chronic pain during physical activity. Secondary osteoarthritis are the other symptoms. Cause of this disease is fracture and mechanical vascular interruptions, corticosteroid administration, thrombosis and embolism in dyspareunism, radiation therapy causing vascular injury, increased intraosseous pressure with vascular compression. Sixth is the bone disorders due to the bone tumors. Bone tumors are diverse in their gross morphological features and range in their biological potential. They may remain unnoticed or may be fatal. Most bone tumors are classified according to their origin. Hemopoietic bone tumors are 40%, chondrogenic are 22%, and osteogenic are 19%. Although the cause of most bone tumors is unknown, but in certain cases, genetic alterations play important role. Commonly reported bone tumors are osteomas. The symptoms of these are slow growing tumors in which round or oval tumor, that means swelling due to the inflammation, project from the subperiosteal or endosteal surface of the cortex. These are often noticed in skull and facial bones. In patients suffering from Gardner syndrome with intestinal polyps, multiple osteomas are seen. Cause of these are they may be induced by infection or trauma or by hemangiomas. Second is osteoid osteoma and osteoblastoma. These are benign bone tumors and are composed of haphazardly interconnecting trabeculae of woven bone, which are prominently rimmed by osteoblasts. The intertrabecular area are filled with the vascular loose connective tissue with large number of dilated and congested capillaries. The actual tumor area is surrounded by abundant reactive bone called nidus. It causes when certain cells divide uncontrollably, forming a small mass of bone and other tissues. This growing tumor replaces healthy bone tissue with abnormal hard bone tissue. Third category includes osteosarcoma. It is a malignant mesenchymal bone tumor and accounts for 20% of primary bone cancers. Though it can occur in any age group, but is more commonly about 70% reported in the patients below 20 years. It is more commonly reported in men 1.6 than women 1. The frequency of osteosarcoma is about 60% in the knees, 15% in the upper parts of the hind limbs, bones, and pelvic bones, 10% in upper part of the humerus, though any bone of the body may be involved. As far as symptoms are concerned, most common type of osteosarcoma is primary and intermedullary, arises from medulla. It arises in the metaphysis of the bones and involves formation of bulky and grayish-white areas with hemorrhagic spots. Later, it spreads extensively in the medullary canal and replaces the marrow. Sometimes it penetrates through the epiphyseal plate and invades the joints. The tumor cells have large hyperchromatic nuclei and form neoplastic bone, which has a porous and lace-like architecture. Cause of this is genetic mutation from the fundamental cause of osteosarcoma. Most commonly involved gene is RB gene, which causes retinoblastoma, though it may arise due to the mutations in the cell cycle regulatory gene like p53, CDK4, and cyclin D1 and MDM2.
So this is all about the effect of aging on skeleton and different type of bone disorders, whether they are genetic or acquired. In the next session, we are going to discuss that how different questions may be framed from this chapter. Till then, goodbye. Thank you. So this is all about the effect of aging on skeleton and different type of bone disorders, whether they are genetic or acquired. In the next session, we are going to discuss that how different questions may be framed from this chapter. Till then, goodbye. Thank you. Hello everyone, I am Dr. Adarshdeep and this is the unit test of effect of aging on skeleton and bone disorders. First of all, very short answer type questions which you have to answer in 2 to 3 lines. The first question from this category is define bone disorder. Second is enlist various age-related factors which affect the skeleton. Next is name the canals present in the bones. What is the cause of Paget's disease? Next is differentiate between primary osteoporosis and secondary osteoporosis. Name the genetic bone disorders. Next is define arthritis. Name its various types. Second category of questions are short answer type questions which you have to answer in a single paragraph. So first question from this category is differentiate osteoarthritis, rheumatoid arthritis and gouty arthritis. Next is explain the causes, effects and prevention of rickets and osteomalacia. Next is what is osteoporosis? Explain its types and causes along with structural peculiarities. Next is differentiate between dried bone and calcified bones. Next is state the cause and symptoms of osteosarcoma. Next is state the cause and symptoms of bone disorders caused by abnormal mineral homeostasis. And the last question from this category is define osteomyelitis, differentiate pyogenic and mycogenic osteomyelitis. Next category of questions are long answer type questions which are explanatory in nature. So first question from this category is enumerate various bone disorders caused by bone tumors. Next is describe effect of age on various bone of skeletal system. Next is write short note on rickets, osteomyelitis and osteoarthritis. And the last question from this category is what are acquired bone disorders? Describe its causes and symptoms. The bone disorders which you have to describe are osteoporosis and Paget's disease. So this is all about the questions. Write all the questions and make a PDF and send to your college to the teacher. It will help you in examination. Good luck. Thank you.